Even though it's the case that we are living in volatile times in American politics, I think that we shouldn't get demoralized, even though it's easy to get demoralized, because when we just take a moment to stop and reflect on the journey thus far, on the progressive movement catalyzed by Bernie Sanders, we have gained a lot of momentum, we've gained a lot of ground, and I think that it's important for us as a community to come together and think about the progress that we've already made. Think about what we've done in terms of healthcare. We've monopolized the healthcare debate. There's no doubt about that. We have monopolized political discourse with respect to this one issue. Progressives now set the terms of debate when it comes to healthcare, and now a majority of House Democrats support single-payer healthcare, even though the rest of the party is reluctant to get on board with that. But nonetheless, we did this. We made this progress. We are part of a cultural shift that is changing the way we talk about healthcare in America, and the New York Times has an article where they really highlight how this is the case. So at rallies and in town hall meetings and in a collection of blue state legislatures, liberal Democrats have pressed lawmakers with growing impatience to support the creation of a single-payer system in which the state or federal government would supplant private health insurance with a program of public coverage. And in California on Thursday, the Democrat-controlled state Senate approved a preliminary plan for enacting single-payer system, the first serious attempt to do so there since then-Governor Arnold Schwarzenegger, a Republican, vetoed legislation in 2006 and 2008. Yet, as Democrats regroup from the 2016 defeat, leaders say the party has plainly shifted well to the left on the issue, setting the stage for a larger battle over the healthcare system in next year's congressional elections and the 2020 presidential race. Their liberal base, emboldened by Senator Bernie Sanders' forceful advocacy of government-backed healthcare last year, is increasingly unsatisfied with the Affordable Care Act and is demanding more drastic changes to the private health insurance system. In a sign of shifting sympathies, most House Democrats have now endorsed a single-payer proposal. Party strategists say they expect that the 2020 presidential nominee will embrace a broader version of public health coverage than any Democratic standard-bearer has in decades. Roseanne DeMoro, the executive director of National Nurses United and the California Nurses Association, powerful labor groups that back single-payer care, said the issue had reached a boiling point on the left. Supporters of universal health care, including activists with Ms. DeMoro's union, repeatedly interrupted speakers at the California Democratic Party's convention in May, challenging party leaders to embrace socialized medicine. Demonstrators waving signs with single-payer slogans have become a regular feature at town hall meetings hosted by members of Congress. There is a cultural shift, said Ms. DeMoro, who was a prominent backer of Mr. Sanders. Healthcare is now seen as something everyone deserves. It's like a national light went off. That's exactly it. A light went off. And me personally, I've never seen this much enthusiasm. Even back in 2009, when Democrats took over government and they were discussing healthcare, even though I wanted a single-payer system, I mean, I don't see the momentum then that I see now when Democrats have no chance of passing this system. And it's because we are done taking crumbs, we're done with incremental change, and when you look at H.R. 676, it was introduced just on January 24th with only 61 co-sponsors, and as of May 24th, it managed to garner 61 more co-sponsors, bringing it to a total of 112 co-sponsors, which is a majority of House Democrats. And this would not be possible without your activism, and we are now literally witnessing a paradigm shift in this country where we're no longer talking about healthcare in terms of it creating revenue and profits for private health insurance companies. We're actually talking about the abolition of private health insurance companies because they don't serve us, they serve themselves, and we're done with that. We want healthcare that actually does what the name implies it does, provide health care and coverage to citizens, to all citizens. We're not going to leave out people. We want everyone to be covered. And when you look at public opinion polls, Pew Research found that 60% of the country believes it's the government's responsibility to ensure that all citizens have health coverage. And this includes 85% of Democrats, up 8 points from March of 2016, and 32% of Republicans, which is a 13-point swing between March of 2016 and now. So in just 9 months, public opinion moved even closer to single payer in monumental ways. So there's been a cultural shift. And even though it feels as though we're not making any progress, we're making progress. We are changing culture. And the thing about cultural shifts is that even though it happens automatically with the general populations, there's usually one pusher. There's a catalyst that always tends to push culture in one way or the other. So you can look back to the early 2010s when pop culture was responsible for pushing LGBT rights. And between 2005 and 2010, you saw this huge swing in support of marriage equality and LGBT rights. And we're seeing the same type of swing now, but the question is, who is the individual or thing that catalyzed this cultural shift with respect to single-payer healthcare? Well, that's easy. That individual is Bernie Sanders, who announced his presidential campaign back in April of 2015 and changed the terms of the debate.
If you raise the issues that are on the hearts and minds of the American people, if you try to put together a movement which says we have got to stand together as a people and say that this capital, this beautiful capital, our country belonged to all of us and not the billionaire class, that's not raising an issue. That is winning elections. That's where the American people are.
So that was a clip from the day that Bernie Sanders announced his presidential campaign, and it was the day that not just America, but the world changed forever. What he did was he raised the issues that we care about, and he overcame a 60-point deficit and nearly beat a political behemoth like Hillary Clinton because of it. So we're not talking about just defending the ACA. We're not talking about making progress and moving towards a public option. We're talking about a single-payer healthcare system just like Canada's. And this is because Bernie Sanders catalyzed that cultural shift. Without him, we would not be having this discussion, or certainly not as much as we are now. So even though I get frustrated with Bernie Sanders for different reasons sometimes, we have to credit him for this, because this is what he did here in pushing us forward when it comes to the issue of single payer. That's something that we are all indebted to him for. So I'm incredibly thankful to him. And look, even though, again, it's easy to get demoralized, even though Republicans are attacking the Affordable Care Act right now, they want to repeal the Affordable Care Act, think about how we've changed culture and the impact that that will inevitably have on policy. It's inspiring when we really step back and think about it. We're making progress. It's slow, but it's happening.
Support this podcast by joining the independent progressive media revolution today at humanistreport.com.